I'm an internal medicine physician. I am in primary care practice. I do both outpatient and inpatient, practicing in St. Joseph, Missouri. And since I have integrated McKenzie into my primary care practice, it has been life-changing. McKenzie really focuses on understanding the problem, understanding the issue. So a patient is coming with any kind of pain. I think we as doctors, we have, we have been trained and kind of demanding from the patient also, okay, we need to mitigate the pain or we need to suppress the pain. And I'll share with you doing this, doing McKenzie in my practice for last 3 years or so, having an understanding has really revolutionized my practice. A patient came in as an acute appointment and she said, "Oh doc, my blood pressure is running high." So as I started to talk to her, I said, "Okay, so have you checked your blood pressure?" So she says, "No, I haven't checked it, but I've been having headache. And I know it is from my blood pressure. One time my blood pressure was 150/84 or whatever she said." So I said, "Okay, so at the time when I was seeing her, she was having a headache. And I checked her blood pressure, it was borderline high, it was 148. And she has been taking ibuprofen and other pills, painkillers for her headache. And she works in a factory where she's bending down, picking up clothes, and she works in a laundry company. And so looking at the history, I felt it was a mechanical headache rather than from the blood pressure. And I didn't know. First, I wanted to understand whether the headache is from blood pressure or the blood pressure is from the headache. So do simple movements, made a posture correction, did simple movements, and the pain disappears. So she walked out of the hospital without any blood pressure pill, stopping all the painkillers, and also fixing her headache. And that is what the beauty of McKenzie is in understanding the problem. So it is like giving all the power back to the patient, and he's the judge. He's the gold standard. The gold standard is the response from the patient, not based on blood tests, not based on MRIs, not based on any fancy genetic test. It is as simple as that. It has been an amazing experience. Despite doing residency in internal medicine twice, one in India, one in US, and after a decade of clinical experience and going through all the evidence-based guidelines for back pain or whatnot, I always felt a gap in ability to understand what exactly I'm dealing with. And I think the answer finally come true after I got introduced to the world of McKenzie Method and understanding what mechanical pain is and what to do about it. And I think it has helped me in forming a complete circle.